Hi, my name is Dr. John Wessling, and I'm here to talk about parents who are at their wits' end trying to cope with the restless and upsetting behaviors caused by their unhappy and troubled children and teenagers. And this is a condition called ADD or ADHD. Now, ADD stands for Attention Deficit Disorder, and ADHD stands for Attention Deficit Hyperactivity Disorder. The term ADD has largely been replaced with ADHD, as it describes two of the most common symptoms of the condition: inattention and hyperactive impulsive behavior. Now, most children display a combination of these two traits and may show the following symptoms. They may struggle in school, have difficulty with relationships, suffer from low self-esteem, frequent fidgeting or squirming, feels restless, or often runs or climbs excessively, has difficulty playing quietly, talks excessively, interrupts often, may blurt out answer at inappropriate times, always seems on the go, has difficulty waiting his or her turn. So as you can see, many of these symptoms could describe most all children at one time or another. Now, adding to the parents' frustration is not knowing the cause of the symptoms, nor what to do to fix them. It is no surprise that those dealing with ADHD-affected individuals can become desperate for answers. So the intent here today is to provide you with powerful insights that will help you take control of this problem without expensive or dangerous medications. Now, one theory behind ADHD is that it is caused, at least in part, by inherited genetic factors. Another plausible theory is exposure to environmental toxins. But as usual, few are focusing on nutrition, which I believe is a key factor. We know food choices of most children and adults today are incredibly poor. It is next to impossible to expect a child to have normal behavior if he or she has a poor diet consuming of all the wrong things, causing metabolic and hormonal imbalances. You add to that the substandard amount of nutrients in foods, and you can see a real pattern emerging. This is a real recipe for disaster. You simply cannot have a child with a healthy, functioning brain when the proper ingredients to develop or maintain a healthy brain are not being given. ADHD can be hard to diagnose due to its many diverse symptoms, leaving it much up to interpretation, or should I say misinterpretation. That means that countless numbers of children or adolescents who could simply be bored or immature may be misdiagnosed with ADHD. Now, the treatment of choice for ADHD has been drugs and medications. However, there is a growing body of evidence that the drugs do not work any better than doing nothing at all, especially in the long run. But they have a long list of side effects, including sleeping problems, insomnia, fever, aggression, restlessness, high blood pressure, headaches, and an irregular heart rate, just to name a few. Now, all too often, a more comprehensive approach is needed to get to the bottom of why someone experiences the symptoms of ADHD that they have. If you have someone with ADHD, we can treat them using NutriSpec, which is a nutritional program and a nutritional company. We take a look at your blood work, thyroid panels, lipid panels, urine and saliva testing, along with filling out a metabolic assessment form. We then determine what vitamins and nutritional supplements are right for your child. Now, I know what you may be thinking. You have had all the blood work done and it all came back normal. Well, there is a difference in what normal is in the lab ranges and what normal is in the optimum function ranges. Lab ranges is averaging the test results of people who are sick or who are already experiencing symptoms. Optimum function ranges are averaging the test results of people who are healthy and normal. This is a big difference. It does not make sense to compare your blood test results to averages taken from people who are sick or who are experiencing symptoms. That's why being normal is not good enough. Now, normal blood test scores simply mean you are not yet as sick as the rest of the population used to determine the normal range. So the reason why this program is so successful is because it is based on testing and not guesswork, and also doing follow-up retesting to determine your progress. So from this information we can tell what foods and what supplements will bring your child into nutritional balance, as well as what foods and what supplements will tend to do harm. Now, perhaps you are listening to this video because your child or other loved one has been on drugs for ADHD and the drugs have been disappointing, giving disappointing results, or only made them worse. It is never too late to switch to natural therapies, which will ensure that you treat the whole person rather than just a set of symptoms. If you are interested, you're welcome to contact me at wesslingchiropractic@yahoo.com, or my office number is 316-262-3931. I look forward to hearing from you.